I am Rafael Bravo, was part of the Windrose Health Network board of directors for a long time. I was invited back in 2004 to join the only two clinics that were available, the Edinburgh and Trafalgar Family Health Centers. Those were the names that I can recall were operating back then. And I became very attached to the clinics and the organization and became committed as part of the finance committee initially. And then I ended up my term in 2014 after 10 years as chair of the board. That was a great experience because as an immigrant and dealing with all kinds of people, our board was very diverse, and I was very happy to be part of the group. We did a lot of things, and I'm a firm believer that we have an obligation with the community we live in, and Indiana was and still is my home, even though I moved back to Columbia a year and a half ago. I miss Indiana a lot. The friends that I encountered, the friendships, the hospitality, the welcoming of the Hoosier people, that was great. My kids, my oldest son is still in Indiana. My daughter Isabel graduated from IU last year, and she's currently in Columbia. She's traveling back next Thursday, and she's trying to get a job in Florida. In 2004, the organization was very small, but we had a group of people very, very convinced of their mission and the significant role played in providing quality health care to underserved communities in the south side of Indianapolis. It is very shameful to see that the safety net in the last years have gone down. Government, especially in the last administration, wasn't very committed to the underserved and the poor. I would like to emphasize how Windrose exists today because of the devotion of the staff and the board. That is something that I want to emphasize because the staff is a vital player in the future and present future, and has been for many years. And that kind of mix that we had with the board. I would like to also say that Windrose exists because of immigrants. Part of the growth during the past has been thanks to immigrants, not only Latinos, but the Burmese population on the south side of Indianapolis. So that has enabled Windrose to grow and succeed, definitely. I would like to also mention that without the government, the family qualified health centers wouldn't survive. That's part of the role that government has to play, helping the poor and the underserved. Great memories, or what impacted me the most. I could count numerous memories, but I would highlight the dedicated work and sacrifice of the board members all along Windrose history. I cannot leave aside when we received, I remember perfectly, a $1 million grant to build the Hope Clinic and from HHS, and how this clinic has served that community in the southern part of India, southeast part of Indiana. I think that was a key moment in the history of Windrose. And I would say it was the launch for newer projects. Let's put it that way. The future. I keep saying that even though the future is always unknown, especially today, nobody knows what's going to happen. Everybody's waiting, hoping for a good recovery all around the world, in particular, the developing world. People and organizations make it happen daily, if and only if there's a goal in mind. If the board and the organization as a whole doesn't have a goal in mind, the future doesn't exist, period. That is what Windrose has accomplished throughout the existence. Helping the poor with quality health care, looking for opportunities to grow and expand with the aid of government programs, other related organizations, and most importantly, with communities. That link between Windrose and communities is key, and it has been key for many years. I just would like to say that my time during which I was part of the board, it was pretty much part of my life, and I loved it. Thank you for the opportunity.